We found that there is a secret sauce to dealing with our neighbors who are experiencing homelessness. And it's the comprehensive approach. It's what we're doing here.
We're proud to present the Stout Street Recuperative Care Center and the Renaissance Legacy Lofts upstairs. We're here in this 9-story building with the first three floors dedicated as recuperative care, and the upper 6 floors providing 98 units of permanent supportive housing. The Recuperative Care Center will provide 75 medical respite beds, recuperative care for persons experiencing homelessness who end up hospitalized due to an acute medical condition while they're on the streets, and who, if housed, would be discharged to home, but who cannot be safely discharged to the streets without bad outcomes.
It was a baseline study that we did in 2012, 2013, where we found 250 people experiencing homelessness who were housing insecure. And those same 250 people did something like this. They had an amazingly expensive cycle from the street to the hospital, the emergency room, back to the street to the jailhouse, back to the street to detox. It's an expensive cycle. And what this project here at Legacy and with the health program tied to it helps us to do, along with the social impact bond program, is to break that expensive cycle.
There's no cookie cutter approach to doing a development like this. There's no toolkit, there's no grant source that says, send in an application and we'll fund the Recuperative Care Center. We basically had to figure it out ourselves and put the pieces together. It's a $46 million project funded by 8 different foundations and 500 individual donors. There are 4 governmental entities that provided funding for the project and 3 different types of tax credits.
What makes this recuperative care facility so unique, it's not necessarily just the number of people it will serve, but also the type of care that it will provide.
Now, the coalition will provide 24-hour supervised care with nursing, medical care, behavioral health supports, and social work and housing counseling to be able to connect people to ongoing primary health care and integrated health care, both through the Stout Street Health Center and other places, and ultimately to get them on the path to long-term housing after their recuperative care stay.